Hi, this is Pete. It is the 2nd of August 2022. Um, Recording this the night before surgery. So tomorrow I'm having C5, C6 disc replacement as I have osteoarthritis in the neck. The discs have thinned out and I have bone spurs and a bilateral nerve pinch. I've had this for a number of years. Put up with it, didn't realise what it was. It didn't bother me much, but eventually it grew to a point where it did start to interfere. I started joining up all the dots of little health problems I was having, and realised that was the source of it. So I have slight pain down my bicep, forearm. I don't really have any numbness in my fingers, and the level of pain I've got there is quite low actually. It's probably 1 to 2, but it will grow. I do get pain in the front here, in the traps and the rear, and the muscles get extremely tight and guarded. And I do get pain all the way up the back of my neck here, particularly here. And that results in lots of headaches and migraines, unfortunately. So that's been a real pain dealing with migraines. Never had migraines before until a few years ago, and they're obviously a lot more severe than headaches and a lot more difficult to treat. I was eventually prescribed propranolol to take, which is preventative, and I didn't agree with that because it sort of reduced my heart rate too much. So I take sumatriptan now when I get a migraine to kill it off, and that is quite effective. But the main drivers that I want out of surgery, when I'm having surgery, is to get the mobility back on my neck. So I have very restricted movement to the right. That's as far as it goes. I guess the bone spurs stop it from moving. To get rid of the arm pain, and really preemptive, not to. I don't want to be in a position where it's quite heavy and severe. Um, some people struggle with that for months and months after trying to get rid of it. So um, yeah, that's preemptive on that side. Um, Reduce the migraines or eliminate the migraines. Get rid of all the neck pain, muscle guarding, etc. And also, I have a few weird things like tinnitus on the right side, which I think might be down to the bilateral nerve pinch that I have at C5, C6. So that's the main drivers, really. Um, I chose the options are actually we're having fusion or disc replacement. I didn't think I was a great candidate for fusion because I have problems at other levels as well. There's more disc thinning at C3, C4, but it's described as moderate, and at C4, C5 there is a slight disc bulge as well. So the disc thinning at C5, C6 is described as severe in the radiologist report. I did have a few steroid injections at various levels. The one at C5, C6 was most beneficial, so that's why we've targeted that for surgery. One thing I would advise would be to get second opinions. I've actually seen 5 surgeons to get their opinion. And I had one surgeon say, can't see anything wrong. One surgeon say, I want to remove 3 levels, and then the rest were 1 to 2 levels. So I think it's important there and interesting that they've all got slightly different opinions, so you can get rid of the outliers, the one that couldn't see a problem or the one that wanted to take too much out, and then focus on the other 3 surgeons. So I've picked my surgeon, which will be tomorrow at the Wellington Hospital in North London, and it will be disc replacement. Okay, so that's it. I think I'll record this after the next one, after a few days after, 2 or 3 days after surgery, see how we are. I've had a bit of surgery before, so I know it will be tricky the first week. I've had a Lynx implant for gastric reflux and an inguinal hernia as well, and also gallbladder disease. So I've had 3 surgeries before, so not looking forward to it, but it's got to be done. Done all the non-surgical treatments, therapies I could do for the last 2 years. Some are good, but they don't fix the problem. You just getting through every week by week and trying to maintain it. So eventually, my decision was to remove C5, C6. So that's it. Thanks. I'll give you an update in a few days. Thank you. Bye.